All right, we like. Welcome to the Malawi Diaspora Network Diaspora Discussion. I'm Mwiza, Munthali, your host with the Malawi Diaspora Network. I want to thank you for supporting the Malawi Diaspora Network fundraising campaign to raise money for PPE for Malawi's healthcare workers. And also thanks to those who participated in and supported in our virtual benefit concert last Saturday. The concert was a great success. We're close to our goal of 15,000K that we're trying to raise on GoFundMe. Please help us reach or surpass that goal by submitting a contribution on the campaign's GoFundMe page at www.gofundme, and then that's at the page is actually MDN PPEs for healthcare workers in Malawi. That's MDN PPEs for healthcare workers in Malawi. You can also support the MDN COVID-19 PPEs for healthcare workers in Malawi on Cash App, and the Cash App is MDN Malawi PPE. Again, the Cash App is MDN Malawi PPEs, and again, the Cash App again is MDN Malawi PPE. The Zeal site is you can contact PPE for Malawi at gmail.com. That's for Zeal. Go to PPE for Malawi at gmail.com. And I want to also acknowledge all the organizations behind the Malawi Diaspora Network. That's the Malawi Washington Foundation, the Malawi Association in Washington, the Malawi Community in the USA, Malawi Seattle Association, Malawians in Texas Organization, New England Malawi Association, and Embassy of Malawi for their support. That's the Embassy of Malawi for their support. Today we're excited to share three new videos about the impact of COVID-19 in Malawi and the importance of PPEs. These were recorded prior to last week's concert, but were not previously aired. First, we're going to have Thoko Kachipande, who is a health communication expert, sit down with Dr. Eliya Zulu, who is Executive Director and founder of African Institute for Development Policy. And they're going to have an in-depth discussion where he talks about the data on the deficit of PPEs, and also he talks about the advocate that he does for the need of evidence-based data to drive and influence policy. And he's also going to share the highlights of the social, economic impact of COVID-19 in Malawi, and also highlight the lessons learned and what the diaspora can do to help slow the spread of COVID-19. So we're going to have now the discussion between Dr. Eliya Zulu and Thoko Kachipande.
Okay. Hello, I'm Thoko Kachipande, a fellow Malawian who is proud to be part of the PPE fundraiser for Malawi. Next, we have Dr. Eliya Zulu, and he's joining us all the way from Nairobi, Kenya. Hello, Eliya.
Hi, Thoko. How are you doing?
Great. Thank you so much for joining us for this important event.
Thank you.
So Eliya is the founder and executive director of the African Institute of Development Policy.
We're gonna start again for those folks.
He's also a seasoned public health and policy expert who has served on many international panels, including at the World Health Organization, the UK Royal Society Study Group, and addressed members of the United Nations General Assembly, as well as held other leadership positions. Eliya, tell us a little bit more about your work with AFIDEP and your history in public health.
Oh, thanks, Thoko. I think I should start by just saying a big hello to all Malawians and friends of Malawi who are participating in the this virtual benefit concert. I should also thank the organizers of the concert for coming up with this this idea. It's very, very timely, really. Because as we look at the COVID-19 situation, we really need to think about how to protect the health workers who are really the ultimate warriors in the battle against COVID-19. And thanks for your introduction as well. But getting to your question about the organization that I work for, AFIDEP. AFIDEP is a research and policy institute whose primary mandate is to make evidence matter in determining cost-effective policy and program responses to uplift the lives of Africans across the continent. So what we do at AFIDEP is that we seek to institutionalize a culture of consistent evidence use in the formulation and implementation of public policies in general. But our work also focuses on 5 areas that we believe are really key to achieve sustainable development in Africa. And these are population change, education and skill development, health and well-being, and the environment. So it's a regional body. We are headquartered in Nairobi, but we also have an office in Malawi. And right now at an advanced stage of setting up another office in Francophone West Africa. It might be Abidjan from the look of things. So in a nutshell, that's what we do. I mean, with respect to Malawi, we work closely with a number of ministries as well as the Parliament of Malawi. For instance, now we are working in partnership with the Copenhagen Consensus Center in supporting the national planning, the newly formed National Planning Commission, to come up with a policy prioritization analysis framework that will help the country determine the policies that are well placed to maximize the returns for each kwacha that is invested. So we hope that through this program, working with the National Planning Commission, we will actually also contribute towards development of the new vision, the long-term vision that is going to replace Vision 2020, but also help to kill this disease of really how do you move from policy to implementation? Because if you really come up and determine the best interventions that can help move the country forward, that's what will actually help in terms of enhancing implementation of policies. And through this project, we've also come up with the first comprehensive modeling in Africa of the socioeconomic implications of the COVID-19 pandemic, and the results of this were actually featured in the Economist magazine last week. So that's part of the work that we are doing. National Planning Commission. We also support Parliament of Malawi, enhancing the capacity of Parliament in using evidence more generally, but also in enhancing effectiveness of the Secretariat in supporting the work that parliamentarians do. A key aspect of this work actually involves enhancing the autonomy and independence of the Malawi Parliament. As we've a lot of people who are following, the goings in Malawi now, you see that Parliament is really largely incapacitated. It's mostly controlled by the executive arm of the government. So this program is really meant to help Parliament come up with laws, reforms in laws, including some amendments of the Constitution that will really ensure that the doctrine of separation of powers between the three arms of government in the interests of all Malawians. So maybe coming now to the main topic, Thoko, of this, which is PPE and the work we do with the Ministry of Health. We are doing a number of things with the ministry at AFIDEP. One of them is strengthening the institutional capacity of Parliament, of the Ministry of Health, I'm sorry, in using research evidence in their work. And as part of that, we've been supporting the Public Health Institute of Malawi in synthesizing evidence that is informing public health responses to COVID-19. We are a member of the Infection Prevention Task Force that is responsible for responses to protect health workers and patients from COVID-19 infection. Yeah, so in general, that is part of what we are doing in the health sector, and in general supporting work in Malawi. But as I said, AFIDEP has a regional mandate. We work across Africa. In the last 5 years, we've worked in about 22 African countries, doing this sort of support, basically influencing, promoting evidence use in decision making.
That's great. So it looks like you're doing a lot of policy work, looking at how you can strengthen health systems and have a positive impact on the long-term basis. But let's talk about the current situation with COVID-19 in Malawi and how you're supporting healthcare workers. Now, there are 3 general public health responses when a crisis like a pandemic occurs. Could you talk briefly about them and where Malawi is at this point?
Yeah, so you're looking at the initial stage, which is the what you'd call the emergency stage, where, as everybody saw what was happening around the globe, you immediately think about what should we do to stop this. And so that's the emergency stage, where you are really reacting to the situation. And a lot of the responses that a lot of governments went for in this emergency period is really to curtail movement of people, lockdowns as we've seen around the world, and so on. In Malawi, I think you can say that it's more or less like transition from the emergency to what you'd call the transitional stage, to the stage where now the 3rd stage, where you are looking at rebuilding. So the transitional stage is where you feel like you've gotten a handle of preventing the exponential sort of growth of the infections, where you really the main focus is you do something to the term that is used to flatten the curve, so to prevent excessive transmission of the infections. And so I think in a way many African countries have kind of took some drastic actions at the very beginning and managed really to prevent that exponential growth. And we could say that Malawi is more or less transitioning from that to the intermediate stage. And then as you go along, because as you know, WHO has come up to say that this is really going to be a long-term problem. It's a problem that we have to learn how to live with. So I think you'll see that more countries, including Malawi, will be moving from the sort of responses that characterize this emergency period, really to be going into the intermediate and the rebuilding stages of the epidemic.
Really, that's where our PPE call stands in right now, because we're looking at stabilizing things and flattening the curve, as you said. And so just find PPEs play a role because they prevent transmission.
Yes. So PPE is very, very central, because at the end of the day, as the numbers grow, I mean, we have less than 400 numbers in Malawi as of now. I mean, 400 cases. But the point is that the cases are going to grow. More so when you look at the situation with what is happening with the political rallies, where huge numbers of people are coming together and so on. going to undermine the efforts really to prevent this rapid transmission of the disease. So we just have to hope that it's not going to be, things are not going to escalate. But the protection of health workers, as the numbers grow, we'll see more and more cases go to the hospitals. And we know that our health system in Malawi is already a pressured health system. We already don't have enough doctors. We don't have enough nurses. In many places you go, you don't have enough medication. Supplies are not there. Now, when you add on COVID-19, it's just going to put so much pressure on the system. And I think so that's why I think the initiative that the Malawi Diaspora Network has come up with is very, very laudable, because the point is that there isn't enough resources really to help build the capacity of the health system to protect the health workers, but also to protect the patients who are going to be going to the hospitals. I was looking at some data actually related to this. There's a tool that is being used. It was originally developed by the World Health Organization. It's called the Malawi COVID-19 Essential Products Quantification Tool. In this tool outlines what is needed in the health sector when you project the sort of numbers that are expected based on what we know about how the virus has spread or grown in other parts of the world. And so it outlines what is needed in terms of PPE, but also other aspects of the health response, like hygiene and medical supplies, medical equipment, medicines and infrastructure that is needed to protect health workers as well as protect and treat the patients. And when you look at the data that was done for the 3-month period between April and June, PPE alone had a funding gap of about $6.3 million. While when you look at the totality of all those supplies and including the others and so on, the funding gap was about $43 million. That is after you take into account the contributions that various development partners are brought in. But when you look closely at those data as well, I think we shouldn't just be talking about PPE in general. There are various components of PPE. And so we need to check with the Ministry of Health to say, really, where are the real gaps even within PPE? Because the tracker, what the tracker was showing, for instance, was that there were excessive supplies for protective gowns, disposable caps, and disposable shoe covers, while the biggest gaps were in medical masks and medical gloves, where on the masks, actually, you had a gap of about 20 million pieces just for the health sector to function properly. So I think the gap is there. It's big, as you can see, $6.3 million if we have really to equip the health sector to adequately respond to COVID-19. So it's really very, very important that an initiative like you guys are doing, the Malawi Diaspora Network is doing. We really need to get more funding to what the government and other developing in place.
Absolutely. I know here, Western government, that they have been concerned about the shortage of hospital beds and the lack of PPE for healthcare workers, and for hospitals in particular. It's been ventilators. What's the ventilator situation like in Malawi?
I think Malawi doesn't have that many ventilators. I mean, you look at many of the public hospitals, even the referral hospitals, you're not going to have an ICU that has more than 5, 10 ventilators. So even when you look at what needs to come in, and this is a population of what, 18 million people, and so really, I think the point that needs to be understood is that countries like Malawi are not going to build the sort of health infrastructure that we've seen Western countries build. The economic muscle is simply not there. So that's why I think the issues to do with prevention, the issues to do with making sure that you don't have as many people getting the serious complications, that has to be the main strategy, because it's not really going to happen to have the level of the ventilators, the people have to go in ICU. The moment we start getting big numbers getting into those sort of situations, I think chances are that it's going to be a very, very catastrophic situation. But I think the point about PPE is that the health workers, we already have few. The moment we lose guard and see a lot of them getting infected, we'll lose the numbers and the system will just be totally incapacitated.
Absolutely. I think prevention plays a big role, but there's also a socioeconomic impact. Can you talk a little about what we're currently seeing and what the long-term impact might be?
Yeah, so I think it's very, very important to note that COVID-19 is really a cross-cutting problem. It's not just a health problem. Restrictions in movement of people are bound to undermine efforts to fight poverty. They are going to, especially for the most vulnerable people, the people who can't work from home, because I mean, now we're talking about virtual working and so on. But what does virtual working mean for somebody who works in a market, for somebody who is selling merchandise or just doing a lot of pieces of work, what we call in Malawi, ganyu? So but the thing is that the vast majority of people, the vast majority of workers are in the informal sector. So as we think about the medical response and restricting people's movements, I think the end result of that is that we are going to have more and more people becoming poor and lacking food and so on. So like I mentioned that our institute, AFIDEP, and the Copenhagen Consensus Center worked with the National Planning Commission to produce the first ever modeling of the socioeconomic impact of COVID-19 across Africa. This is the first modeling that has been done in Africa, because as you have seen, most of the models are actually focusing on health, how the epidemic is likely to grow and so on. And in our analysis, we showed that actually if Malawi had a lockdown that had to continue, say, for 9 months, that would help to avert about 12,000 COVID deaths, which is quite a positive thing. But I think because of the socioeconomic impacts that are associated with this, you see that more people will go hungry because they will not have money, they will not have, their livelihoods will be undermined. And a lot of people will also not be able to move to access health services. Because of the hunger, people will be more vulnerable to TB, to malaria, to HIV, and so on. So in the end, you see that the net number of deaths, because the hunger, the lack of food, and the other problems will increase deaths resulting from the other causes. The end result is that actually the net decline in deaths will only be half of the 12,000 that would be saved from COVID. But more critically, our analysis also looked at the long term. If, for instance, schools would be closed, say, for that 9 months or up to 1 year, and all these restrictions continued, Malawi, the lockdown in Malawi would leave the country about $12 billion worse off due to people not working and interrupting children's education, which would then also undermine their long-term learning potential. So I think the main message here is really to emphasize that there has to be a balance. It's not really a choice between saving lives and saving livelihoods. There has to be a balance between the two, especially that we know that this problem, we are going to live with it for a long time. You can't just close markets, do lockdowns and so on, because the impacts of that alone might even be bigger than the problem of saving lives that we are looking at.
Right, it definitely could be catastrophic, and we definitely don't want that. But it sounds like with the proper support, like what we're doing and the proper policies, like the work you're doing to try to support the government and forecasting and looking at different scenarios, it's something that could be contained and we could have a better outcome.
Yes, for sure. I think that it's possible to do both, and I think the African countries have been cautious. A lot of them who did lockdowns are opening up and so on. But I think for a country like Malawi, we need to beef up the capacity of the health system to treat patients, to reinforce prevention, I think one of the critical things we need to know, because right now in Malawi, I don't think that we know the full extent of the problem we are dealing with. The numbers look small, but we haven't even started doing community testing, because most of the testing is happening in clinics for people who have symptoms, or it's actually being done on people who are coming into the country from abroad. But we haven't started doing any community testing in the way that other countries like Kenya and Ghana have actually done in Africa. But even more critically than just doing community testing, we need to do a random sample, because it's that random sample, that random sample of people who are carefully selected, that will actually help us understand what proportion of the population, for instance, is infected, or are there, how many people are there who are not showing symptoms, who are spreading the disease, and so on. So there's a lot. There's need to generate more locally relevant evidence. There's need to support the health system so that we don't have to wait until we start having a lot of people coming to the hospitals. We need to build the capacity of the system. And I think the initiative of the Malawi Diaspora Network in doing your part, in doing our part to mobilize resources that help protect our health workers is very, very laudable. And I hope that many other Malawians, both within the country and in other parts of the globe who are there, can actually come and chip in as our way of giving back to our motherland as well, to support the country in dealing with this very, very serious problem.
So what other lessons can Malawi learn from different crises that have occurred, you know, like through Ebola, and even like for the situation that we're observing in the Western nations who are in a different situation, but looking at how they handled it, and also looking at the other countries that you talked about, like Kenya and anywhere else? What lessons can Malawi learn from them?
I think the key lessons Malawi can learn really is to make sure that you understand the gravity of the issue you are dealing with. A lot of the lessons from the West are probably not applicable for the reasons I said earlier on. I think a lot of the responses the Western countries, especially on the socioeconomic aspect of it, are not affordable for a country like Malawi. So I think the health response are trying to really fight this from the health perspective is going to be the best weapon that the country can have. I've talked about the issue about expanding the testing capacity, because you can't act like you are driving a vehicle without a speedometer or without knowing, having a gauge for your fuel. So you don't know, the car just stops. You have to know what is the problem you are dealing with. And so far has shown that Malawi has actually been doing very well in doing contact tracing for the number of people that were being tested. It has one of the best records, but the point is the numbers that have been tested are not huge enough really to test that capacity. So I think the big lessons are really to make sure that we expand the capacity to understand the problem, to understand the epidemiology of the epidemic itself, but at the same time do more research within the countries to understand how the COVID situation is affecting various sectors, and come up with affordable responses that can actually mitigate these challenges. But every country is different. There are different countries that have taken different policies and so on. I think we have to look more inwards and make sure that, like, for instance, how long can Malawi close its borders? We are a landlocked country. But we can have a mechanism where we test everybody who is coming in. I mean, in Zambia, we know Zambia has kept, Ethiopian Airlines continues to fly to Zambia now. They are flying to Mozambique. So you don't have to close the economy completely, as long as you know that you have the capacity to test and quarantine people who need to be quarantined.
Absolutely. So you touched on a couple of different things, like the importance of, it sounds like, supporting the healthcare system, as well as supporting our healthcare workers and protecting them with efforts that we're doing. And some of the good behaviors that like the best behaviors that you talked about from Kenya, and other countries that are similar as far as economically and health system-wise to us. What can people like us who are here and who are participating in this fundraiser today, what can we do to help set Malawi on the right path?
I think that a big part of what we need to do to Malawi is to continue challenging our leaders there. I think what's happening to me in terms of the political rallies is really very, very unfortunate, because you have huge numbers of people. As I said, our best weapon is to prevent the issue, to make sure that we are doing some levels of social distancing, but allowing the economy to continue. But once you allow big groups of people, so it's to continue putting our voices. I think a lot of us who live outside the country like to sit on the fence. Maybe we write things here and there on social media, but I think it's time now to be bold. I think one of the things for me, I think needs to happen. I'm glad to see the diaspora network coming up. I think we need to have a Malawi global diaspora community that will actually put one voice of people who are living in the diaspora to start engaging with the government. But beyond that, I think it's sending the messages that this is a serious problem. I think many of you guys in the US, in the UK have seen, I've seen how this has really devastated undermined overwhelmed the health systems and the economies there. And for our country that has such limited resources, we can't afford to be careless and dismiss it as a non-problem and indulge in behaviors that are going to escalate the situation. So the messaging to the people we are linked to, but I think what you are doing, what the diaspora network is doing in mobilizing resources, I think there's so much that we can achieve in actually dipping a little bit in our pockets and collectively putting that money. That money can make a big difference in terms of helping the health workers, but enhancing the capacity of the government to actually handle this problem.
Absolutely. I think we all can do our part in many different ways, from being a part of this fundraiser and engaging with it and donating and just setting up larger efforts to get us to where we need to be with a better health system and better results. Thank you so much for your time, Eliya. So informative and so fantastic. And thank you for participating and just supporting Malawi the way you do.
Thanks, Thoko, and thanks for the good chat we've had, and all the best really to the Diaspora Network. And let's make it happen, Malawians and friends of Malawi. I think that we have an opportunity here to give back and help reinforce our country's capacity to deal with this global problem. Thank you.
Absolutely. Thanks.
That was a conversation between Thoko Kachipande and Dr. Eliya Zulu. Dr. Eliya Zulu is the executive director and founder of the African Institute for Development Policy in Kenya. And there he was discussing the data on the deficit on PPEs and highlighting the social and economic impact of COVID-19 in Malawi. And also talking about the lessons learned and what the diaspora can do to help slow the spread of COVID-19. And relating to that, as you know, the Malawi Diaspora Network has a campaign for PPEs for healthcare workers in Malawi. And you can support that campaign on the GoFundMe page. At the campaign is MDN COVID-19 PPEs for healthcare workers in Malawi. I guess, again, the GoFundMe campaign is MDN PPEs for healthcare workers in Malawi. And of course, you can also support us on Cash App. That's MDN Malawi PPE. Cash App is MDN Malawi PPE. And for Zelle, it's PPE4, the number 4, Malawi at gmail.com. That's PPE4, the number 4, Malawi at gmail.com. And we're trying to raise $15,000. We're close to the goal. So hopefully you can get us over the top. And also, if, you can also go over. So we don't mind going over. So we're trying to get $15,000. We're very close. I think at the time we got on the air, we were at $12,900. So we're very, very close. So all we need is a little over $2,000 and more. Of course, we can also go over more. So again, that's at the Malawi Diaspora Network campaign for PPEs for healthcare workers in Malawi. And today, as we mentioned, we're excited to share these 3 videos, the new videos about the impact of COVID-19 in Malawi and the importance of PPEs. And this was recorded prior to last week's concert, but not previously aired. So now we're going to go to a conversation with Dr. Titus Divala, who's a physician and epidemiologist who's advising the Malawi Ministry of Health in the response to COVID-19. And he shares some data on epidemiological modeling of COVID-19 in Malawi and the importance of keeping healthcare workers safe from PPEs, including national surveillance teams. Dr. Titus Divala is based, of course, in Malawi, and is a medical doctor, epidemiologist motivated by high infectious disease burden affecting populations of Malawi and Africa. He has been a clinician since 2009 and a researcher since 2011. He has worked on interventions for malaria during pregnancy, preventive treatment of HIV-positive individuals, optimizing patient outcomes during tuberculosis investigations and diagnostics for tuberculosis. Dr. Divala is now in the forefront of providing COVID-19 epidemic management advice to the Ministry of Health through various committees and the public through the media. He's also a member of the Society of Medical Doctors, SMD, a steering committee member of the London School of Hygiene and Tropical Medicine, TB Center. Malawi is a country ambassador for the Royal Society of Tropical Medicine and Hygiene, and a lecturer at the University of Malawi College of Medicine. Here is Dr. Titus Divala.
Greetings, fellow countrymen. It is an honor to be here with all of you, people who love Malawi. To me, the 6th of June is not an ordinary day. It is the eve of my wedding anniversary, and being in this US-associated event brings me back to 2014 when I celebrated my first wedding anniversary in Baltimore. This is also the year I joined the Malawi Association in Washington. Thank you so much for organizing this concert, not just because you love music, but because you love your country and you love your healthcare workers back here in Malawi. I joined the epidemiological frontline in March 2020. After analyzing some modeling that showed that Malawi, despite having a young population, would be hit really hard by COVID-19. We have been available to the Ministry of Health ever since that time. As a country, we registered our very first case on the 2nd of April, and a few days later, we registered our first death. Our current confirmed 419 cases are either returning residents, their contacts, or healthcare workers. Considering that we have not been routinely screening individuals outside these groups that I have mentioned, we believe that in the population there are thousands of cases. Modeling suggests about 7,000 or more cases in the population. So what it means is that we have people who have the disease but don't know and can easily come to health facilities for care. When they come to health facilities for care, it is only PPE that brings a barrier between COVID-19 and healthcare workers. Keeping healthcare workers COVID-19 free is critical, because if one of them is down, our health system is already overstretched to collapse. Just to give you an idea of how stretched we are at the moment and why we need to keep each and everyone up and running. If one symptomatic person in Dirande, in Bayani, someone notices symptoms in them, what they need to do at the moment is to call the health system. We have a toll-free number. Once they call that number, the district sends a team to that household. In that household, there are a number of people: clinical, nursing, laboratory, as well as surveillance. All those individuals have to be in PPE. And after assisting that particular individual, that PPE, most of it is discarded. It is no longer useful for the next case. And we get numerous of these calls, some of them for those with symptoms needing to be screened, some of them coming from individuals who are already under quarantine but have developed symptoms, some from individuals who are already COVID-19 positive and need some care. So the demand for PPE is unprecedented. But remember, we still have other diseases that are still in our population. We have HIV, tuberculosis, hypertension, diabetes, maternity, vaccines for children. All those services need to run. If we are to really be serious about keeping each and every one of our healthcare workers COVID-19 free and alive to keep the system running, each and every one of these services needs to be delivered by well-protected healthcare workers who use PPE. The demand for PPE is therefore very high. With our 2nd April start, we are now approaching an accelerating phase, upward acceleration phase of our epidemic. This makes your initiative, therefore, very timely. We at the Society of Medical Doctors hope that many people will donate to this basket. The demand for PPE in the next few weeks is going to be accelerating together with the epidemic. Whether the epidemic comes very strong or not, the demand for PPE will not stop, because we need to keep a watchful eye. Just to appreciate how busy the health system will get in the next few weeks, I'll walk you through the overall burden projections. We project that if COVID-19 behaves similar to the way it behaved in China and Europe, and 50% of Malawians get it, 115,000 will require to be hospitalized, 29,000 will require intensive care, and 26,000 may die. Our health workforce does not match these numbers in any way. This is far too big a burden, but trust me, we are doing our best and we will not stop. All we ask from you, our citizens, people who love Malawi, who are not Malawian, what we ask from you is that you support us. Support us with a good work environment that is safe to operate in. Support our families. Keep us safe. Keep us at peace as much as possible. This is why the Society of Medical Doctors sincerely appreciates of PPE for Malawi and others who have been donating to Malawi workforce since the beginning of this pandemic. Others have given us health insurance, life insurance. Others have given us PPE and various other forms of support. We really appreciate Ziko Mwambiri.
And that was Dr. Titus Divala. Again, that was Dr. Titus Divala. He's a physician and epidemiologist who's advising the Malawi's Ministry of Health in response to COVID-19. He shared some data on the epidemiological modeling of COVID-19 in Malawi and the importance of keeping healthcare workers safe with PPEs, including national surveillance teams. As you know, this is a conversation which is part of the Malawi Diaspora Network Diaspora Discussion series, and today we're featuring 3 videos that were recorded prior to the concert, the benefit concert we had last week, but were not aired. And we wanted to remind you again that we're in the midst of our campaign for PPEs for healthcare workers in Malawi, and our goal is $15,000. $15,000, and of course we've already gotten at the time of coming on today. We had $12,900. So we still need to get your support so we can reach the goal, and hopefully we can even surpass the goal. That'd be great. So go to the GoFundMe page at the MDN PPEs for healthcare workers in Malawi. That's MDN PPEs for healthcare workers in Malawi. And also you can support us at the Cash App. That's MDN Malawi PPE. That's MDN Malawi PPE. And that's MDN Malawi PPE. And the Zelle information is PPE4, the number 4, Malawi at gmail.com. Again, the Zelle information is is PPE4, the number 4, Malawi at gmail.com. And now we're going to have Mr. Prince Butani. He's an entrepreneur, founder and sole proprietor of Prince Barbershops in Malawi. Prince Barbershops are located in Blantyre and Lilongwe. And he shares how COVID-19 and related measures to curb the spread of the virus have impacted his business. And so here's Prince Butani.
Hello, good people. My name is Prince Butani, founder and sole proprietor of Prince Barbershops in Malawi. So where the business stands right now, it could be worse if we had a lockdown in this country, but it's not good at all. Mostly we've suffered a drop in sales that has resulted in the dropping of numbers of employees working for us and most of the businesses here in Malawi. So we have been using the funds that we have saved from last year's business year end, which we meant for further expansions and also reinvestments. But as of now, we have used these savings towards rental overheads, wages, sanitizing our premises, providing proper working attires for our staff in line with the local government's directives in prevention of COVID-19. In the same line, we constantly considering protecting both our clients and also our customers. As you are aware, Prince Barbershops recently opened its largest branch in Lilongwe, the capital city of Malawi, last year in November. So to meet the overheads in the new city, the city which is almost pretty much expensive, it has been pretty hard with this country's status due to COVID-19. As you are aware, we can say a little bit healed from the political pressure that we've been having from last year's elections. So just as we about to exit the political pressure is when the COVID-19 thing came in about. I can say that about 80% of the savings from the 2018-2019 financial year has gone in sustaining the business, keeping it afloat and paying back our loan with the facility, because right now it has never been about making profit. It's been about just making sure that you stay in the business and you don't go off the business, because if you are out of the business right now, it's going to be very hard to come back in the business. In addition to what we've been doing, to protect both our employees and our clients. We have also managed to raise the awareness of the COVID-19. We have at least used 10% of the savings from the last year end to make available programs and proper messages that will help people and the rest of the world to be aware on how they can prevent the spread of COVID-19. We recently elected billboards in Malawi's major cities that carried messages on these measures. Frankly speaking, we're not sure about when this problem will end. And right now, I think things are getting worse because we have seen a lot of cases being reported on a daily basis. We have seen a lot of Malawians being repatriated from South Africa, and we have also seen the rise in the number of cases. I think we had about 50 last month, and as we speak now, we have about over 300 cases. I think there is a great need for our health workers to be fully equipped. I've seen a lot of non-governmental organizations. I've seen a lot of companies being there for our forefront workers that are there 24/7, making sure that they curb the situation, that are making sure that they meet the people who are positive. So I feel like there is a great need for these people to be given enough materials, the eye shields, the gloves, the gowns, because these are the people that are working in the front line, and we see that there is a great need for them to be supported in each and every way that each and every citizen would manage to do in their own part, and in whether in a bigger way or in a very small way, as much as the government is doing something about it. But I believe as the citizens of Malawi, we also have a part to play in making sure that our health workers are well equipped with enough PPE. They are doing a lot of work and they require safety, and we all have to get involved to make sure that their safety also matters in our lives. GoFundMe is a platform that has been created by Malawian in Diaspora Network to help the health workers in Malawi, because these people, they're doing a massive job, they're doing an awesome job, they're doing a phenomenal job to make sure that our COVID patients they stay protected, and making sure that there is a way of trying to cover the situation. So wherever you might be watching these videos from, wherever you might be streaming from, I would like to urge you to make a donation through GoFundMe, because it is through this program that our health workers here in Malawi, they'll get adequate support, they'll get adequate PPEs, and they'll stay safe, just like you and I are staying safe. I believe together we can fight COVID-19. I believe together we can defeat COVID-19, and I believe that together we can stay alive, because the future is bright. Thank you.
And that was Prince Butani. He is an entrepreneur, founder, and sole proprietor of Prince Barbershops in Malawi. And he was discussing how COVID-19 and the measures surrounding dealing with COVID-19 have impacted on his business. But he's also urging people to support the frontline workers, the healthcare workers who are dealing with this issue, and urging people to support getting them PPEs. And that's what the Malawi Diaspora Network's campaign, Malawi Diaspora Network PPEs for healthcare workers in Malawi is doing. And as you mentioned, you can support that campaign by going on the GoFundMe. That's at Malawi COVID-19 PPEs for healthcare workers in Malawi on GoFundMe. And I also want to acknowledge early on you saw Dr. Titus Divala as well, who was speaking to us earlier, and he's a physician and epidemiologist who's advising the Malawi's Ministry of Health's response to COVID-19. And early on, you saw Dr. Eliya Zulu, who is the executive director of the African Institute for Development Policy based in Kenya. And he also was highlighting the data, sharing the data on the deficit of PPEs, as well as looking at the social impact of COVID-19 in Malawi, and also the lessons learned, and what the diaspora can do to help slow the spread of COVID-19. Although, relatively speaking, compared to the US, Malawi's the numbers are low, but as you heard last week, the World Health Organization has said that the COVID-19 is accelerating in the continent. So there's still a lot of work to be done to make sure that COVID-19 does not impact badly on the continent in general, but also specifically on Malawi. So that's why we've set up this campaign to make sure that we support the healthcare workers who need the PPEs, as you know, protective personal equipment, which are very scarce. Even in normal times, they're very scarce. And even here in the U.S., which has much more funds and resources, even here, there are not enough PPEs. So what more a country like Malawi? So that's why we're coming to you to make sure that you support the healthcare workers on the front lines back home in Malawi. And again, go on the GoFundMe at MDN PPEs for Malawi. Sorry, MDN PPEs for healthcare workers in Malawi. MDN PPEs for healthcare workers in Malawi. And also the Cash App is MDN Malawi PPE. The Cash App is MDN Malawi PPE. And Zelle is PPE 4 Malawi at gmail.com. That's PPE 4 Malawi at gmail.com. And I think that's the end of our Diaspora Discussion series today. I urge you to go to the GoFundMe page. Also go to our Facebook page, the Malawi Diaspora Network, like our page, the Malawi Diaspora Network. Send your comments to on that page as well at the Malawi Diaspora Network if you have any questions, comments, ideas as well for what we're trying to achieve. And I want to acknowledge again the Malawi Diaspora Network is composed of the Malawi Washington Foundation, the Malawi Association in Washington, the Malawi Community in the USA, Malawi Seattle Association, Malawians in Texas Organization, New England, Malawi Association, and supported by the Embassy of the Republic of Malawi. I'm Mwiza Munthali of the Malawi Diaspora Network and part of the Malawi Association in Washington. Have a great day, have a great week, and stay safe.